Wow, my first client since graduating nursing school. I should make a plan to guide my client health teaching to make sure I don't forget anything. Let's see. My clients are a single dad and his young daughter, and they are coming in to get some information about the Gardasil vaccine. I should start out by doing a quick family assessment. Because Caitlin is a preteen, I will assess her maturity level and knowledge, as I know talking about puberty at this age can be awkward. I can apply the concepts of CFAM and utilize family interviewing techniques to understand how the family interacts with each other. I am going to use manners. I know this might be an awkward situation for both the father and the daughter, so I need to remember to use all I know about therapeutic communication by listening and offering commendations. I can organize this information using CFIM to find an appropriate domain to target my intervention. This will allow me to work with the family and answer all their questions appropriately. Hey guys, my name's Emma. I'm going to be your nurse today.
Hi Emma, I'm John.
Nice to meet you, John. And what's your name?
Caitlin.
Hi Caitlin, nice to meet you.
Hi.
So, why don't you begin by telling me a little bit about why you're here at the clinic today?
Well, Caitlin's turning 13 soon, and I just have a couple questions regarding her health care over the next few years. I'm a single dad. Her mom and I are separated, and I just don't really have a lot of help with that.
It must be tough to be a single parent. You mentioned that you don't have a lot of support, so there's nothing outside of you that helps raise Caitlin?
Thank you. It has been difficult. We don't have any outside supports. We've been managing okay, but lately I'm just having trouble connecting with Caitlin regarding just body changes and sexual health. We're really close, but with no mother figure around, I just find it hard to relate with these changes.
Well, yeah, it's weird to talk to my dad about periods and stuff.
Yeah, I understand it can be difficult to talk to your dad about those kinds of things, but it's really great that he's so interested and invested in your health, Caitlin. Are there any pressing concerns that come to your mind that we can focus on today?
Caitlin's pediatrician suggested she should get the Gardasil vaccine. She missed it when she was in school, and so I just don't know if I should give consent for her to get it.
Okay, so why don't you start by telling me what you do know about the vaccine?
As far as I know, it protects against STIs, and Caitlin's only 12, so why would she need it if she's not having sex?
So Gardasil is a vaccine that does target the sexually transmitted infection human papillomavirus, also known as HPV, but as a preventative measure. Here's the website about Gardasil. You can take a look at that. So if Caitlin does get the vaccine, she'll receive 3 doses over a 6-month period of time.
What is HPV?
HPV is an infection that's most common in your 20s, but it can lead to many other health problems later on. So the vaccine is offered for both boys and girls to prevent genital warts, but in girls and women it's also used to prevent cancer of the vulva, the vagina, and the cervix, which can be pretty serious.
I didn't know it prevented against cancer. That's good to know. However, my main concern is just that she's still really young to be having sex.
So whether or not Caitlin's sexually active now, it's good to be proactive about her sexual health. Some people think that being vaccinated against an STI will lead to them having sex earlier, but this is a common misconception.
What are the side effects of Gardasil?
So because it is injected into the arm, you may experience a headache or a little bit of a fever. You may also experience a bit of redness or itching around the injection site. However, these are very minor and they will subside pretty quickly.
Those side effects still sound pretty scary though. Is it even worth getting?
Getting a needle can definitely be a little bit scary. There is a chance that you won't experience any side effects, but if you do, they should subside fairly quickly. I can give you a little bit more information about the vaccine that you can take home with you.
Thank you.
So would you recommend that she gets the Gardasil vaccine?
In my professional opinion, the pros of the vaccine most definitely outweigh the cons. Like I said, it does help to prevent against multiple cancers in women, and the vaccine is offered for girls ages 9 to 26, so Caitlin is within the safe range to receive the vaccine. If you choose to get the vaccine, you can make an appointment here at the clinic to get it now, or it will be offered again at your school in grade 9, and she can get it then as well.
Thank you for providing us with this information. It was really helpful. I think we're just going to take a couple days to go over it and think about it.
Of course, that sounds great. Thank you guys for coming in today. Do you have any other questions for me?
No, thank you. That was really helpful.
Awesome. Well, it was great to meet you guys. Thank you for coming in today.
Thank you.
I'm glad I used the concepts of CFAM to assess the family structure and dynamic to better understand how to provide patient-centered care to John and Caitlin. By utilizing the concepts of CFIM, I provided them information to help them develop a better understanding as to what Gardasil is. I think I also changed how they felt towards it by helping them view it as more of a preventative factor to protect Caitlin against HPV and cervical cancer. I think our interaction could possibly lead to Caitlin getting vaccinated in the future. I believe establishing a plan by educating them on how to get Caitlin vaccinated will be effective, and I will follow up with them at the end of the week to answer any more questions they may have and provide support and guidance, as I know they don't have many outside supports.